Hello, everyone. This is Jumi Olawale. Welcome to Life, Love, and Therapy podcast. I would like to let you guys know about an upcoming women's conference, and it will be taking place on the 21st of September. I'm going to have amazing women speakers that will be covering topics such as how to build resilience and take care of ourselves using yoga and mindfulness techniques. We're going to be talking about boundary setting, perfectionism and vulnerability, balancing our career, motherhood, and marriage, sex, intimacy, desire, and libido, and also how to move through transitions when we feel like other people seems to be thriving and we just feel like we're not progressing. I can't wait for you to be in attendance and listen to the amazing women that are going to be talking at this conference. So you can get your tickets as soon as possible by going to eventbrite.com and searching for Embrace the Mess Women's Conference. You can also find the tickets on my Facebook page at Jumi Olawale Therapy and Counseling, as well as if you go on my Instagram page, you can also find it at Jumi Olawale the Therapist. Welcome to Life, Love, and Therapy. I am Jumi Olawale. This show is about learning tips, advice, and ideas about how to improve our lives and relationships from the viewpoint of a therapist. I'm so happy to have Acacia Cook on Life, Love, and Therapy. She's going to be sharing with us about what it's like to live with an autoimmune disorder. And I'm going to have Acacia introduce herself to you and what she does.
Hi, awesome. So I'm Acacia Cook. So I am a full-time therapist with the STAR program at Ohio State University. I work with clients who have experienced some kind of trauma, have been affected by crime within the last 3 years. And then I also work part-time as a therapist with a private practice called Holistic Consultation in Columbus.
Acacia, could you please tell the audience about your journey? How were you diagnosed and what were the series of symptoms and experiences that culminated in this diagnosis?
I was diagnosed with Myasthenia Gravis in February of this year. So it's actually kind of a bummer of a story. I was on my honeymoon when I presented symptoms. So my husband and I, we had just gotten married and we were in Las Vegas. And we were there for about 5 days. And third or fourth day, I couldn't focus my eyes. Probably like the day after that, my right eye just shut and it wouldn't open. We didn't know what was going on. So by the time we came back home, I had set up an appointment with my eye doctor. He said that it was a third nerve palsy, but the issue was they didn't know why that was happening. So basically my right eye wouldn't move up. So I couldn't open the eye and then the eyeball wouldn't move up. And so third nerve palsy, he didn't know what was going on. He sent me to another doctor who said that it could be a slew of things. The options that he gave me were it could be a brain aneurysm, it could be a brain tumor, I could be having a stroke, or it could be this autoimmune disease, Myasthenia Gravis.
None of that sounds good.
None of it sounded good, and I'm freaking out. I'm crying, and I'm calling my husband. I'm like, I don't know what's going on. I need to go to the emergency room. So they sent me to the emergency department for a neuro check. I ended up admitted for 3 days, getting a lot of tests done because no one was really sure, again, what was going on. And myasthenia gravis is a disconnect between your nerves and your muscles. So antibodies form around your nerves, and so you can't send that message to your muscles to work. I have ocular, which means it just affects my eyes right now. Hopefully it doesn't progress, but there is a chance that it could progress and become systemic. It affects your voluntary muscles. If I end up having issues with swallowing or chewing or arms and legs, I can't move my arms and legs, or breathing, those means that it became a systemic issue and I need to get to the emergency immediately. It's not a quick test to be diagnosed with myasthenia gravis. And so they told me that it would probably take a few weeks before I got any of the blood work back. Before that, I was in the hospital. They did a test for Guillain-Barré they did a spinal tap for Lyme disease. So it was just a slew of tests that was happening, and I'm in the hospital and I'm worried and I don't know what's going on. Once I was discharged, I ended up going to the neuro-ophthalmologist that I see now, who's wonderful. And he looked at me and within like 15 minutes said, yeah, this is definitely myasthenia gravis. I'm going to start you on this medication. And so it's just been a journey from there. A lot of different medications and symptoms and things like that. A lot of the medication has symptoms that aren't always the greatest.
I can't believe that. That happened on your honeymoon?
Yeah. And it was very quick. One day things were fine. My eyes were open. They were working. And then the next day it just kind of looked like my eye was a little droopy. We put some ice on it. Then my eye wouldn't focus. Then it was going like out to the side a little bit and not opening. And yeah, it happened very quickly. And I think that was the hard part because it happened so quickly. I still don't really have a reason why, as much as it's just kind of something that was lying dormant, and that's when it presented itself.
You get back and then they have to do a slew of tests. And one of the things that I've heard people that have an autoimmune disease is they have to do a slew of tests. Like you have to spend so much money until they finally are able to figure out, if they figure out what the issue is.
That's been like the hardest part. I mean, I was, really lucky. I was working at the hospital at the time, but it's definitely financially draining to, even once you find out what's going on, you have to see specialists. Like I'm going to see a neurologist this upcoming week. You go through all these tests and it's really expensive and
yeah,
it's a lot.
I can't imagine the sheer amount of stress of having to keep all those different appointments and making sure you go to them and taking the time off to make sure that you're able to get there, and the medical bills. And what I've heard about autoimmune disease is that you want to keep your stress low, but I feel like even the process of taking care of it and managing it in itself is a source of stress.
It really is. It's managing all the appointments, because when I first started seeing my neuro-ophthalmologist, I was seeing him every 3 weeks because my eye wasn't getting any better. And so I was seeing him every 3 weeks and then trying to get into the neurologist, which took a long time. This is my first appointment with the neurologist coming up this upcoming Monday and started in February. So
wow.
It's, managing all those appointments and then trying to keep my stress levels down, and I'm working. And I think it's hard because when this hit, there was a lot of life transitionings happening in general. Just getting married, becoming a stepmom, starting a new job at the time. I was like about a month out from starting my job at OSU. So a lot of life transitions happening and then getting hit with this diagnosis. It was a lot.
What does that now mean for you as you reimagine yourself? You're still the same person, but now you're dealing with something on top of just the general life stressors that we all have to deal with. What is that like for you now, seeing that you're someone that has this autoimmune disease?
I was born with cerebral palsy, so I've always had some kind of chronic condition. And so for me now, it's just kind of added on to that. And I think that what's hard for me is it took me a really long time to become comfortable with myself and having a disability because I have cerebral palsy. I use a crutch to walk. A lot of why I became a therapist was because of my own self-esteem stuff and having a really great therapist who helped me through that. But being at a place where I was comfortable with myself and then to be hit with having this autoimmune condition and the way that it presented was very obvious. My eye is not opening. Months where I have one eye or I'm wearing an eye patch. Changing that, like still dealing with some of those self-esteem issues and not feeling comfortable with myself because, I'm wearing an eye patch, even though I might have like rhinestones on it and that's really cute, but it's still like I didn't feel good about myself. Like I'm on a certain medication, prednisone, so it's like a steroid, and it causes weight gain and, things like some not so good side effects. And so dealing with the self-esteem stuff and feeling good about myself and having this condition has been, I think, probably one of the bigger issues for me.
You said that you were just getting into a better place and, that place of self-acceptance with having cerebral palsy and having a really good therapist help you work through that. And then this just piled on top of it. So how have you been doing with your self-esteem and the medication and the fact that it has side effects of weight gain and probably holding water and making you want to eat because that's what the steroids tend to do. How are you doing on that journey?
So I'm really lucky. I see the same therapist, and she's really wonderful. And still doing my own self-care, my own therapy is really important. And then my husband's really supportive, and my family has been really great and supportive, really encouraging. So I started my prednisone actually about a month ago, and my eyes opened. I have had some not so good side effects from the medication itself, but also, seeing that happen has been really reassuring for me. I also joined a gym, which made me feel really good about myself, because with cerebral palsy, I should have been exercising way before. But now it's kind of like, okay, like you're seeing these body changes.
Yeah.
Join the gym. I feel good after I leave, and people are really encouraging to me at the gym. So that has been a really great outcome from for sure.
So what would you say to someone that has been diagnosed with an autoimmune disorder, maybe recently, or maybe they've had it for years, and they can listen to you and say, yes, that's me, I'm struggling with that. Or maybe theirs isn't one that is visible. They look like they're fine on the outside, which tends to be in this kind of situations. But on the inside, they don't feel good. What would you tell them about your journey and what they should look forward to?
I think that just knowing who you are and knowing that, this is just a part of the process. It's not fun sometimes, and we have bad days. And, we have days like physically bad days, but also emotionally bad days. You genuinely can get through it. If you have the ability to do counseling or have a therapist or even just have a friend or someone to vent to, because my friends have been really great also. I have a friend who has an autoimmune condition. She's been great knowing her journey, having someone to vent to who knows or who understands or who can even just say, I don't know, that's a bummer and I'm sorry that that's happening. Being able to empathize would be probably my best advice for someone.
Yeah, to make sure that they are surrounded by community, like people that can support them.
Yeah, even support groups. I've joined so many Facebook groups for Myasthenia Gravis, because it's nice to know that there are other people out there who are going through the same thing. And sometimes they're on the other side of it where they're in remission.
Yeah.
Or, maybe they're just being diagnosed, or they're not sure what these symptoms are. And you can kind of relate and say, oh, well, that happened to me too. I get a lot of comfort from that, being able to kind of help other people from my own experience, and even them helping me. And I get on there and post, well, what about this? Is this normal? And having other people say, yeah, that happened to me when I was going through this. So
I remember one time I was talking to someone that has an autoimmune disease, and they were concerned very much about the future because it wasn't just a chronic illness. It was one that could possibly be progressive. And they were concerned about, am I going to be able to, well, they were single, am I going to be able to get married? How would I talk to someone who is interested in me about this disease? Am I going to be able to have children? All these fears and concerns that were existential, that was hitting the dreams and goals that they had for themselves, and whether or not they will have to rethink or rearrange these dreams. What have been your experience around that, fears about the future?
Oh my goodness. I remember being in the hospital and, I just gotten married, saying to myself, this is not what my husband, he did not sign up for this. This is too much. And just really worrying so much about, this is just too much for him. We had talked about it when it was the potential with all the other bad things that the doctor had said. But, just having that reassurance that, people are going to accept you for you. And that's, again, something that I've had to learn having cerebral palsy. Dating was not always easy. Having to tell someone that I use a crutch or a cane, I had some not so good responses sometimes. So, yeah, just, the right person will accept you for who you are. I do still have those concerns about, having a family. I really want to grow our family in the next, couple years. And a lot of the medication you're not supposed to get pregnant on. And so that's definitely a big concern. And that's kind of where my concerns are right now. But I'm excited to meet my neurologist and hopefully get some of those questions answered, because I know that it's possible. And I know that that has been a goal for me since I was a little kid. I've always wanted to be a mom. I think that it's possible, and I'm not going to let this conditions stop me from accomplishing that goal. Yeah, I mean, for me, it's just something I've always wanted. I feel so passionately about that, and I don't want to let this condition stop that goal from happening. It is definitely a fear that, I'll get bad news or be on medication that I have to wait months and months and months to, try to have a baby. Those are definitely concerns.
I can't even begin to imagine what that thought process must be like. So how do you get yourself out of ruminating about it? What skills do you use to get out of the ruminations around like your concerns and your fears?
I really have to just kind of walk away from certain things. I have to, okay, Acacia, turn your brain off. Like, this is not a concern right now. I always tell clients, like, we're thinking really far ahead in the future right now. We don't know that this is going to be an issue. And so I have to do that to myself a lot. I'm thinking really far ahead in the future, and I don't know that this is going to be an issue. And I need to, like, turn my brain off and stop thinking about babies and having babies.
Like, stay here right now.
Yeah, I need to be in the present and focus on what I'm doing in this moment that's, going to lead up to that. Right now, I don't have an answer as to, yes, this is definitely going to be a problem, or no, it's definitely not going to be a problem. And so concerning myself with something that may not be an issue isn't helping me. Another thing I always say to my clients, is this helpful? Is this hurtful? So is it helping me to be having these thoughts, or is it hurting me? And so I try to stay on that helpful side.
Yes, because the brain has this habit of just going in a different direction if you don't rein it back in.
Exactly. And in my brain, I mean, I'm totally all the time, like, just, okay, what about this? What about this? What about this? What about this? And so pulling it back in and not worrying about it in that moment.
You're so right, because that's literally our anxious brain. And it is very well documented that people who struggle or who have been diagnosed with autoimmune diseases have a higher rate of developing other mental health issues such as depression and anxiety. And it makes so much sense as to why that can be the case. What are your thoughts about that?
I definitely agree, especially if you get hit with a diagnosis. And a lot of time autoimmune conditions, they can totally change every part of your life. And like some of my Facebook support groups, people who have worked and had, really great careers and things like that, who eventually had to leave their careers because they just couldn't do it anymore. Wow. And so I definitely understand how it can cause a lot of depression. That was one thing that my primary care provider asked me about when I went in and explained everything that was happening. Asked me about, how am I self-caring? How am I doing mood-wise? And things like that. And so I definitely understand how it can cause a lot of depression. It's a major life event to be diagnosed with an autoimmune condition. I definitely understand the anxiety because we never know what's going to happen. We don't know how our body, waking up tomorrow, are my legs going to work? Am I going to be able to lift up my arms to do my job? Yeah. So a lot of that anxiety of the what ifs with our physical conditions, what ifs about our, personal lives and those existential things of, can I do this? Can I meet someone who will be accepting of this? Or can I have that family that I've always wanted? I definitely understand the anxiety and the depression and the mental health piece that goes into it. Do you feel like because you were born with cerebral palsy and because you have been doing your work with your own therapist over the years, do you feel like that helped to prepare you a little bit or acted as some kind of protective factor when you got the news about this autoimmune disease? I definitely think it did help me a little bit. If I'm being 100% honest, I have my days. I go up and down a lot. I would say that when I was first diagnosed, I was just thankful that I wasn't having a stroke, brain tumor, or aneurysm. And so I was, on cloud nine. Okay, I can deal with autoimmune condition, like this is okay. This is fine. And then as I'm getting more symptoms and things are happening, my mood's going down. And so I think that definitely working with my therapist helped, and having cerebral palsy has kind of helped. I think preparing me for the self-esteem stuff that I would probably deal with and that I do now deal with. But I don't know if anything really could have prepared me to be diagnosed with an autoimmune condition. In all honesty, came out of nowhere. And then it's like we put that label on of like, okay, I have an autoimmune condition, and so I don't know that anything would have really prepared me for that.
So sometimes when I have conversations with my client or friends and there is some kind of issue that's happened, especially if they've been through past traumas or past life-altering experiences, there's a sense that this is another pile-on and a sense of unfairness. Like, why does this have to happen to me? I'm already dealing with all of these things. Now I have to deal with another. So from a trauma perspective, since this is what you do for a living, what are your thoughts around that? What conversations did you have with yourself? Or if you're a person of faith, what conversations did you have with God about what the heck is going on? Why do I need this extra layer of nonsense on top of what I'm already dealing with?
I definitely had those conversations, those like, why me? Why is this happening to me? Which is something that wasn't new to me. I had a lot of those when I was younger with cerebral palsy. Why is everyone else getting to wear high heels and I have to wear flats to prom because, this is so embarrassing? Or, a lot of those, why is this happening to me? And now I have this autoimmune condition. My eye is not opening or it's drifting off to the side and I can't focus them. And, why is this happening? I definitely believe in God and a higher power. And I know that everything happens for a reason. And I know a lot of people don't like to hear that, and I totally understand. But to me, I think that everything does happen for a reason. And maybe this was to teach me something, or I don't know. I feel like God wouldn't put more on me than I could handle. And that's something that my parents have always said to me, he wouldn't put more on you than you can handle. And so I just believe that. I know that this is happening for a reason, and maybe it's to help other people who have autoimmune conditions. Or I know that we had talked before, like I really at one point thought like I could, make this a specialty for me, counseling and things like that. And so being able to help other people with my own experiences.
Yeah, whatever you share with them will come from such an authentic place because this is your lived experience.
Yeah, and that's my goal, and so I think that maybe for me a teaching moment, and I try to reframe it and look at it like that, because if I don't, I just think, oh, well, this just happened for no reason and, is a bummer. It's not helping me, making me feel good about any of it. And being able to use this experience to help someone else out. Yeah, what I hope comes out of it.
I think earlier you said you would ask yourself or you would tell your clients, is this thought helping you or is this thought harming you? So it sounds to me like you go to that space with God, like, I've got to believe that there's a lesson behind this, and I've got to believe that I'm going to be able to change lives with this, and I've got to believe that what you're giving me is not going to be more than what I can handle. So I'm going to go with that.
Yep. Exactly. I do. I have to just, I can handle this.
Right.
This is okay. This is doable.
Yeah. Is there one last word that you would like to share with the audience that's listening to you? Somebody that might be going through what you're going through, or they have a family member that's going through what you've been dealing with. What would you like to tell them how to support that person, or what to look forward to in the future, or any words of encouragement?
Don't give up. Don't give up on the person. I know sometimes I have the tendency to talk a lot about having an autoimmune condition, or sometimes, I'm not gonna lie, sometimes I'll even use it a little bit as an excuse, like, oh, I can't do that because of this. And so trying to just kind of bear with that person, especially depending on where they are in their journey, if it's new for them, if they have just been diagnosed, or if it's, something they've been dealing with for a while, just as a support person, just kind of bear with them, because there's a lot of emotions that go into this condition.
Like the grieving too, right? The grieving of it. Mm-hmm.
The grieving of the things that, the expectations that you had that may not be a thing anymore, the limitations that you may have now and things like that. I think that was one of the harder things, was there's just certain limitations, even small things like stuff that I shouldn't eat or can't eat anymore because they cause flare-ups and things like that. So just kind of bearing with them in that grieving process. If you have the autoimmune condition, really just not giving up and knowing that, you can get through this, and it's hard. And like I said, there are some really rough days, some really bad days. But when you come out on the other side, and we do come out on the other side, a lot of times these things go into remission. It can get better. For me, my eyes are open right now. I always say, like, I have 2 eyes that are working right now, which is great. So yeah, it can get better. I don't know that they will stay open for forever. I hope. It's a process, and learning about yourself. And that's, I think, one of the biggest things is learning more about my body and things like that, because I didn't know. I was just putting anything in my body, eating whatever, doing whatever. And I really have to be careful now and watch what I'm eating and exercise and things like that. So
it's a different kind of connection to your body right now.
Yeah, really having to be in tune with myself and with my body, and knowing, okay, something doesn't feel right. I need to lay down. I need to rest. I need to not, there's maybe my stress levels are off. I need to chill out a little bit.
Well, thank you so much, Acacia. This has been so wonderful, and I know that it's going to be extremely helpful for people who have an autoimmune disease, or who have a family member or a loved one that has it, so that they can understand what it's like from that person's point of view, and also how to support them. So I really do appreciate you coming in and sharing some of your experiences with my audience.
Yeah, thank you for having me.
That is it for this episode. Thank you for joining. If you're looking for ways to help this show, please leave a nice review and recommend this podcast to your friends. Also, don't forget to like me on Facebook at Jumi Olawale Therapy and Counseling, and follow me on Instagram at Jumi Olawale The Therapist. If you have any topics that you would like me to cover on this podcast, please reach out to me via Facebook or Instagram. And you can also send me an email to jumiolawale@gmail.com. This is your host, Jumi Olawale. Thank you for listening, and see you next time.